I'm filmmaker and musician Alicia J. Rose, and this is the Menopunks podcast. Hi, everybody. This is the Menopunks podcast. I am your host, Alicia J. Rose, and today we're going to talk to my friend, Nikki. Nikki, can you just kind of introduce yourself and what you do so we can have a quick overview?
Yeah, my name is Nikki Kuehl. I am a family nurse practitioner, and I take care of women in menopause and perimenopause in Portland, in Oregon.
In Portland, we should specify
Yeah.
that. Are you a menopause specialist?
I am, yes.
What does that even mean?
Yeah, it means that I went through all of my nursing school and then my master's to become a nurse practitioner. And then I went out on my own and did a bunch of additional education about hormones and menopause.
Just really quickly, I'm wondering, did you actually really get any education in hormones and menopause when you were going to school to be a nurse practitioner?
Not much, which is interesting because the school I went to really specializes in nurse midwives. And so we did get, some decent women's health education, but the hormone stuff, just not so much.
It's so crazy to me because today, for example, I was listening as I was driving to a place which shall not be named. That is a retail place that to get off my phone, I'll just go and I'll just zone out. It's healthy and very unhealthy. But while this was happening, driving too far away to do this, I heard yet one of a million ads for men's Revive Health. Ugh. And in this ad, they talk about are you feeling your best? Testosterone. If you're not getting enough testosterone, you could feel better. It's completely manosphere, manosphere, manosphere. But it made me think, I want women's health to be like this too, where it's right. Overwhelming people wanting you to take hormones, wanting you to feel your best, wanting and it's so funny. I think that transparency of men feeling at their best with hormones is the exact opposite of the sort of utter non-transparency and obfuscation of health for women and them feeling their best with the hormones. Why is there so much dissonance?
It's the patriarchy. Just, in one sentence, it's the patriarchy. They're scared.
Mic drop.
How scary is it if all of these women who are in their 40s, 50s, and beyond, who have all this life experience, all of this wisdom, and then on top of it, they feel amazing and they're not falling apart. Their body isn't disintegrating. What would our world look like? Totally different.
I mean, Nikki, that is literally the thesis of Menopunks, the movie.
Yes,
every grant application in our pitch deck, it's what would the world look like if everybody could be hormonally optimized without a fight? If we were dealing with facts and information that was based on science and not lies and bullshit.
An ideology, Christian.
My God.
Evangelical Christian ideology. So,
yes. And that's also such a smokescreen, which we can get into at another time. But I feel that whole thing is a smokescreen for a bunch of creepy people who really shouldn't have control of anything. But anywho, I digress. So hormone therapy is, not necessarily for everybody. And I want to state that from what I've learned, it's not a panacea, which means it can cure everything, right? But for the vast majority of women, it can be a quality of life saving fix in your life to sort of reset your baseline of what it feels like to feel like yourself and feel good and feel healthy. And yet, there's just so much confusion and bullshit about all of it. Before we go into the bullshit, I kind of want to hear about how you felt before you really got hormonally optimized with HRT. Can you kind of talk about that? And I know you have some different experiences I thought people would really benefit from hearing about. So why don't you kind of walk us through that if you don't mind?
Right. I actually have sort of an unusual story in the sense that when in my mid-40s, I was diagnosed with breast cancer, just out of nowhere. No family history of cancer whatsoever, let alone breast cancer. And I did the genetic testing. I was negative, so no genetic influence. It was just a random what they would think would be an environmental, right, trigger for cancer. I know, which, you know, and it just happens, right? Cancer just happens. And, you know, I was in my mid 40s. I was still having cycles. I was probably having, in retrospect, some mild perimenopause symptoms at that point, but it wasn't too bad. It wasn't super disruptive. But I had, when I went in and had my first chemotherapy treatment, I was on my period, and that's the last period that I ever had. So it literally just sent me into, you know, medically induced menopause, just sort of overnight. Like, and like, yeah, it just, and it hit me hard. I mean, so bad. I was having hot flashes before I finally was able to start HRT, which we'll talk about that too, because that's a whole other, you know, controversial topic with HRT post breast cancer. I was having probably up to 10 hot flashes of an hour. I mean, they were just, and they were severe. I mean, they would just take me out. It was constant. I couldn't sleep. I would just wake up in a puddle of sweat. We actually bought all these special like sheets and stuff to try to make it more comfortable for me to sleep. My brain fog was horrific. I got a frozen shoulder. So I mean, like, I just got hit with all of it. I couldn't lift my arm, you know, and so I was miserable and no one talked to me about it. And here I am, a healthcare provider.
So wait, nobody told you this is what's going to happen when you went into chemotherapy for breast cancer?
No one talked to me about it. The thing is like, I knew because of my medical experience, like I knew it was going to happen, but nobody talked to me. And I don't know if they just didn't talk to me because I'm a healthcare provider. I try not to tell people when I'm like at the hospital, at the clinic, that I'm a healthcare provider, because I don't want them to not tell me something, thinking that maybe I already know it. But no one had a discussion with me about what that would look like, how that would show up, how I would feel, and if there were any options for treatments. And when I went back to my oncologist and said, I am miserable, like, help me, like, I can't live like this. She gave me an antidepressant, and it didn't do shit. To be honest,
I mean, here you go. Feel slightly better by taking a questionable antidepressant.
And you know, we do have some evidence that there are a couple of antidepressants, medications in that category that can help with hot flashes. And
true.
As embarrassing as it is, back when I was practicing primary care, I prescribed that to people for hot flashes because I didn't know any better. And that's what I was taught. And there were some women who would come back and say, it worked. I feel so much better. Thank you. But about 75% would come back and just be like, it didn't really do anything.
And you're saying you prescribed those pills or that medication instead of actually like HRT at that point? Okay.
Yes.
Okay.
Yes. Because that is what my mentor, that is what my mentors taught me to do, which you know, that's the whole education piece in medicine, right? We're just not getting the right education. I can never be mad at a doctor or a nurse practitioner, any provider that doesn't prescribe HRT, because they just don't know. They have not been taught. They have no idea. It is not even, you know, it's not even on their radar for the most part.
Maybe you can't be mad because you're also a medical practitioner, but everybody else in Gen X is fucking pissed.
And because they should be pissed, but they should be pissed at the patriarchy and at the, you know, at the medical complex, right? That is, and there are a lot of things to be pissed about, but the individual provider, they're just a cog in the, you know, they're just kind of doing their job.
But I do feel like those cogs in the wheel are the front line that we're dealing with when trying to get treatment for hormone therapy or for relief from menopause or perimenopause. And if you're confronted with somebody that's got some kind of empathy and at least willing to listen to you, that's amazing. But from what I hear from the vast majority, is that people don't. They kind of look at their educations, they know what they know, and they say, well, that's not my department, or I don't know. Right. Or, I mean, occasionally there's someone wonderful like you or other practitioners and doctors that are like, absolutely, of course, duh. But this is kind of a new thing that we're dealing with now, which is sort of like, you're such a great example of a practitioner that, you know, you did something completely different before reaching this very vulnerable part of your life. Okay, I diverged, but let's get back to you. So, you were diagnosed with, was it estrogen positive breast cancer?
It was triple positive. So I was positive for everything, you know, estrogen, progesterone, and then the HER2, right, protein. So, you know, what that means is that estrogen and progesterone would feed my cancer, And it was also, you know, pretty aggressive, but we caught it so early, like pretty much as early as we could, because I was getting my mammograms. And so, you know, I still, because of the type of cancer it was, I had to go through all the treatment, surgery, radiation, chemotherapy.
Wow.
But we took care of it. I have no evidence of disease. Once I got through treatment, I was,
Yay.
you know, there was no cancer left that we could find in my body. But yeah, but I was miserable. I was a wreck.
So no cancer, but literally dealing with immediate hellhole, not just perimenopause, like you're fully in like an estrogen deficient state. Like it's all gone. Boom. Everything that was making all the juicy good stuff has left the premises. It's gone.
Building. Yeah.
So okay, so talk me through how, like, what you knew at that moment about hormones and kind of, did you rabbit hole? How did you become radicalized enough to sort of decide whatever you decided next or not? Tell me how that
went. So I had some friends who had hormone practices. So I feel like I had a little bit of like an inside, you know, scoop on this, and they just really encouraged me. They told me where to go to get the education. They was like, you really need to go to this class. So I was like flying all over the country. I went, wow. I was, you know, paying thousands and thousands of dollars to go and get this education. Basically, at that time, I just wanted to figure out what I could do.
So you were still estrogen, you were still not on HRT when doing flying everywhere with 10 hot flashes an hour.
It was, yeah, it was, yes. I was
or like a minute, was it a minute?
I was the poster child. I was like, no, it was like 10 an hour. I was the poster child though, showing up at these trainings, and I just, you know, be like, yes, this, you know, I'm experiencing all of this, like every symptom. And you know, so I went in just thinking, I'm going to learn how to do this so I can educate my oncologist, so I can, you know, get some treatment for this. I need to figure out what's going to help. And then then I rabbit holed, and it was just so fascinating. And I was enraged once I learned the truth. And that's when I decided to open my own practice and to start helping other people, because we know now, like we know the science shows us that it's safe. It is safe, right? For most people. Yeah.
It is. I want to talk about rage for a second.
Let's talk about rage.
So just, I mean, first of all, one of the main reasons I wanted to have you on the pod was to talk about, you know, risk for cancer and HRT, someone who's actually coming out of cancer and their ability to or not to take HRT. And just kind of what the general discourse is about it. Because it's, a lot of my friends have kind of said, well, I have a history of cancer in my family, or maybe they have a genetic risk. Maybe there's not a genetic risk. It's hard to say. Or they had something that was benign early in their life, but they feel like they're just too on the edge. They don't know. Like there's great science, but yet there's still so much kind of cloudy bullshit out there. What did you, when it comes to rage, like, first of all, what made you so mad? Like, why did it make you so mad? Right? Like, tell me about that.
It made me so mad because every single woman who lives long enough will go through perimenopause and menopause. So this is something that we have been going through since the beginning of time. And why in the hell don't we have good information about it yet? Because I will be clear, we still do not have a definitive, this is totally safe when it comes to breast cancer. We don't have that. And that's really only because we don't have the studies. And I can talk about studies, and, you know, just as a general overview, there are 26 like really good studies about HRT and breast cancer, HRT after breast cancer, and HRT's linked to breast cancer. 25 of those studies show that it's either no increased risk or actually decreased risk. But there was one study that showed,
just one
study that showed, and this was after I'm not including WHI in this.
Okay.
So this is after
we'll come back to WHI.
We'll come back to
That's a whole nother rage-inducing situation.
But as far as like the studies that we actually look at now, those 26 and 25 of them show either no increased risk or decreased risk. And the one study that actually ended up getting stopped early, it was flawed. There's a few reasons why it was flawed. That study had 22 women who developed breast cancer while they were in the study. And it's not even sure if they didn't have it before, because they weren't required to have a mammogram before starting the study. And it turns out that even part of those women weren't even taking the HRT. They had opted out. So it's like just this, but that's the study that
Wow.
has just put the nail in everything as far as how people are responding right now. It's
So
wild.
I did not know that. It's interesting that there's one study that sort of says hell on earth occurs, and then 25 other ones that said actually you can
Right.
be a lot better. So you had these things to balance, and what did you decide to do for yourself?
So I found a provider who had gone through the same trainings that I had, right? And so I knew that they really knew the science, and that they had looked at all the same things that I had. And we had a discussion about my cancer, my risk for recurrence, with HRT, without HRT. And what it turned out is that my benefits from HRT outweighed the potential for recurrence. We decided that if I were to have a recurrence, it's not going to be because of the hormones. It's not because of the hormones that we're taking. Reoccurrences just happen, right? So if I were to have that recurrence of breast cancer, I decided that my body would probably be in better shape to handle it than if I was not on HRT because of, kind of all these side benefits. It just, when your hormones are optimized, when your hormones are replenished, you're going to feel better. You're going to be healthier. You're going to have healthier tissues. We have estrogen receptors on every organ in our body, our brain, our heart, everything. And so just think about it. If your estrogen goes away, it's going to be affecting everything. It affects your health. So I felt like if I did have a recurrence, I would be in better shape to fight it if I had been on HRT and keeping myself really healthy. I also found out, for me in particular, and this is just a discussion that each person has to have with a really knowledgeable hormone provider, but it was a higher risk for me to get a recurrence if I had a few drinks of alcohol every week or if I had been overweight than if I took the HRT.
What?
And so this puts it in perspective, right? These are not things that we're talking about. There are things that we're just doing that are totally acceptable that are a higher risk for a recurrence of cancer than taking a hormone.
Wow. So interesting. So you coming out of triple positive HER2 breast cancer decided, you know what? Like, I feel like such shit that I would rather, you looked at all the facts, you looked at the studies, and you're like, I'm going to take that risk. And so how quickly did you feel better?
Within a couple weeks. Within a couple of weeks, my hot flashes had really improved a lot. It took a few months. I would say it probably took 5 or 6 months for us to really dial everything in to where I feel now, which is better than I did in my 30s, which is better than I did before I had cancer and before I went through menopause. Like, I'm feeling the best that I have since like my 20s probably. And but really, within the first couple weeks, I was sleeping better. The hot flashes were starting to improve. I mean, I welcomed 1 or 2 an hour, right? Like, I was like, this
You're
is
like,
nothing
nothing.
compared. Yeah. So, yeah, it was, I got
Wow.
some good relief up front, and then we just kept working on dialing it in, and now I feel great.
I also feel great. And I have to say that is kind of
Yes.
where this whole film came from. And my whole
Mm-hmm.
radicalization was working with the Portland Menopause Collective, which is
Mm-hmm.
Aoife O'Sullivan and her group of doctors.
I love them. I love them. They're amazing.
They such
Yes.
sexy bitches. They're
Oh
just
my
the sexiest
gosh.
bitches of
Yes.
all.
Yes.
And also just like, well, when I went to that conference, they have this amazing t-shirt that says, was she born with it or is it HRT? And I thought, I need to know them all. Like, this just needs to happen. And Aoife's on another one of these pods with me, so people can check that out. But you know, I, as just a regular lay person who was going through perimenopause and then eventually menopause, which was just this year, I really feel like I didn't know anything about it until maybe really I just started feeling it. I mean, this is maybe 3 years ago, and it's funny how much has happened even in 3 years about
Mm-hmm.
menopause and perimenopause. But like, because Gen X just will not go quietly through this part of our dark night. But like, I feel like my whole thing was, okay, so whoa, you as a doctor, me as a regular person, like, we're sort of indoctrinated with this HRT causes breast cancer narrative was really strong. It was everywhere. And it was like, why would I take something that could lead to my death? Even if it's going to make me feel better, it's not worth it. I mean, that was kind of the whole conversation for so long. And then I went to that conference, and not only did I find out that wasn't the truth, like you just said to us so succinctly about HRT does not cause breast cancer, but that actually a bunch of bullshit went down that led to that narrative that HRT causes breast cancer. And quite frankly, I was so incensed. Like I was ready to sort of understand, oh, there's a misinterpretation. Things happen. Science gets better. We're on different hormones now than we were when the WHI, which is the Women's Health Initiative study, started in the early 90s, which, by the way, is where we enter Menopunks in the film. We go into Riot Girl. We go from there. That's where the film begins. But, but you know, in the early 90s, it was just a different landscape, right? And the hormones they used, which I believe were equine, estrogen, Premarin, and medroxyprogestin acetate, which is also like a synthetic version of progesterone, like the micronized progesterone, which is the good stuff. They were kind of set up to fail a little bit. So I found out at that convention, that conference, that like, not only like, is it not just a misinterpretation? Because I thought, okay, you know, so things change, right? But no. We were sold a boat of fucking lies. And it was on purpose. And it was by a bunch of creepy people who unsurprisingly wanted to disempower women. So that's what really kind of put me into the pure rabbit hole of being radicalized, like hormonally radicalized is what I call it, because I realized, oh my God, this is not a simple situation where people are just, the science was just off and this, like, there was no way to just write it off and be like, I mean, people are, I think, understand that it's not, people who at least are looking for relief and are talking to, you know, educated doctors who are seeking more information are finding out, oh, no, actually the current forms of menopausal therapy that we have, which is, you know, estradiol and micronized progesterone and testosterone, those things, those are really, really incredibly safe. Are they not, compared to what we used to have?
They are very safe. They are very, very safe. And I just want to go back to you hearing that story about how we got to where we are and what happened that made everyone afraid of taking HRT. I will never forget hearing that story. And then I was reading it in a book and I looked at my husband and I said, this reads like a thriller. Like this, it does not seem like it could possibly be real. This is so evil. This is so messed up. And
I know
it's the truth. It's exactly what happened. You know, it scared everyone. Like women who had been on HRT for years, all of a sudden, every doctor, every healthcare provider just cut everyone off. Like no one can take it anymore.
My God.
It's just because, like you said, this one group of kind of creepy, mostly old men decided.
It's always old men with no women in the room, Nikki. We know how it goes.
Old white men decided that women shouldn't have hormone therapy anymore.
So you've definitely heard me and Aoife O'Sullivan talk about the WHI. So go back to episode 1 to really get deep into it. But in case this is your first pod and you're like, I need to know about cancer and HRT, the very brief poop of it is that the Women's Health Initiative study began in 1993, right when Riot Girl was like hitting its kind of like in first amazing peak. And 165,000 women were drafted in with the help of the motherfucking Golden Girls, which I found out on my own because I talked to some amazing eyewitnesses who were there for the film. And this study was actually a cardiovascular study, and it was for women between the ages of 50 to 79. HRT and was basically brought in to see how the effects were on women who also might have had cardiovascular difficulties, right? So it wasn't just like HRT, let's see how it goes in older women. It was actually not even an HRT study per se, but we can get into that because that's a whole nother thing that's ridiculous. And when you're studying women for cardiovascular health, you're looking at women who smoke, you're looking at women already with emphysema, you're looking at women who are already at high risk.
Disease. There was a lot of metabolic disease in that, in that group. Yeah.
So these are the women that HRT was tested on, right? And it wasn't the kind we use now, which is super safe, which mimics what's in our body. It was actually synthetic hormones. So 165,000 women, more women than had ever been included in any study ever. I think even since, like, because of the Golden Girls, I will give them credit. They really did a good job. Like, pop culture was utilized to make it such a big deal because they wanted, like, I believe that what I was told was that the campaign for it was help your sisters, help your mothers, help your friends, help yourself. You can basically, you know, help everybody feel better because hormones are great, kind of at this point, which is in 1993, I think 25% of women in this age range were hormonally optimized.
Right.
Well, fast forward to 2002, about, 9-10 years later. And, 1993, it was sort of Clinton beginning and Hillary Clinton, we all think what we think now, but look, like there's a different attention to feminism and to kind of where things were. If you look at Riot Girl, there was just a lot of energy towards let's pay attention to women, right? Very interesting. And this is now, I think hormones really got in vogue in the 70s and 80s, 25% of women. And I'm just going to interject now. Well, do you know how many women are on hormones now? Let me ask you, do you have any idea?
I mean, Nikki? Isn't it like around 5% or something?
Less than 5%. I think 5% is if compounded pharmacies are included.
Okay.
The number I heard was like 1.2%, but I mean, I think you can
I'm not surprised. I'm not surprised. It's so horrific. I'm not surprised.
Between 1% of women and 5% of women, and there's so many more women now, just in general, who are in menopausal age, because, we don't have less people as we continue the universe. Right. We have more, right? So many women were on this in the 90s, right? And then 2002 rolls around. Now things have changed. 9/11 happens. Definitely Riot Girl and alternative rock kind of like apex and poop out towards the end of the 90s. Feminism is sort of taking a weird turn. Bush is in office. Mm-hmm. Then 9/11, then 2002, just a year after that, barely even a year after, maybe 6 months to 8 months. This study, the WHI, was stopped short. Let's just say one of the outlying arms of the study, which was showing women with an increased risk of breast cancer. And the WHI, they take everything seriously. They're going to halt the study for anything if they see anything anomalous, right? But at the time, this was sort of looked at, and the people who ran the WHI were like, whoa, okay, this is interesting. And then the government was like, we spent $1 billion on this study. We want answers. How is it now 10 years in? We've spent tons of money. What are the results? And the truth is, from what I've read, is that the results were sort of nil. It was great for the younger ladies and really not as great for the older gals. And the older gals were the ones who were getting the most cancer in this particular wing of the study. And so, nil. It was like, it's better, it's not better. It's, like after 50, it's sort of, it can be good if you're young enough, but not that great if you're older because your body's already adapted to the deficiency of estrogen. So those are the results. But there's a guy at WHI along with a cohort, I don't know exactly who is in it, and we hope to find out more as we go along with the film, that he decided to pull those results from that cancer-causing part of the study to the front and release those to the press, broadly stating that all HRT for all women causes cancer. And it wasn't...
Yes.
Go ahead, on, please.
I have to interrupt because they scheduled that press conference without even having like a roundtable discussion with all of the scientists who were involved. So they didn't look at it closely, and they just went out with this announcement that terrified everyone.
And it was non-vetted. It was non-vetted.
No,
None
it
of
was
that
not.
yet.
When we went back and looked
crazy.
at it, we could explain it. We could explain how that was a flawed, interpretation. But no, they
went
saw
with it
and they just went with it. And this was like on the news, I mean, it was crazy.
It's on Charlie Rose. Like I have gone down the rabbit hole. I was like, how did this happen? Like, why are we at under 5% of women? We were at 40% in 2002. So that's because overnight, like tons of women, like literally a tidal wave of women were pulled off HRT or took themselves off HRT. And can you imagine, like, I feel so fucking good right now. If some motherfucker tried to take my HRT, I would stab them in the head.
With my cold, dead hands. That's what you're saying.
I mean, I refuse. Like, I feel better than I've felt my entire 30s as well. Like, I can't even imagine somebody just deciding all of a sudden that this thing that was literally like poised to help us age better was actually going to kill us. But it turns out that was bullshit, and that the vast majority of women were never at risk for cancer. And so, unfortunately, because they went to the press before really they even talked to the scientists who had other things to say, because I've talked to Dr. Robert Langer, who said, I was there and they gave us this article fully finished. And we were like, you got it. This is going to ruin lives. And it did ruin lives. And they sent it to the press, and then it went through women. JAMA. It killed women. It put them through so much suffering. I mean, I think people don't really realize how much of like an absolute criminal and immoral act was perpetrated on all women, how we were robbed of choice of how to basically feel better during one of the hardest times of our lives. I mean, in our life, for women, it's the equivalent of castration. Is that not true? How does that work?
Yes, it is. It is the equivalent of castration. And the thing
That's really
is not,
scary.
yeah, and it's not just that women were suffering with their symptoms. When I say it literally killed women, because estradiol is what keeps our bones strong. So women end up
Mm,
with osteoporosis. And when you're in your 80s, you fall down and break a hip, your
God.
chances of dying, just right, they go up.
Yeah.
And
Yeah.
so broken hips, but also urinary tract infections. We know now that when we don't
Right.
have estradiol, that we'll get more urinary tract infections. That kills older women as well, because they don't have the same symptoms as younger women. They may not know that they even have it until it's too late. They end up
Mm,
with a systemic infection, and then it kills them. And then dementia. So estradiol
mm.
also, we have some good evidence that estradiol protects the brain. And so then, women have, I think it's
So
something like
much.
twice the amount of Alzheimer's disease than men. Well,
Ugh.
we don't have any estrogen to protect our brain, right?
I mean,
So,
they do. I guess they don't go through this, so maybe they do have estrogen in their brains. I mean, right? Isn't that kind of, so men have more estrogen in their brains than women at that point, probably?
right. I mean,
Naturally?
yes, men create estrogen as well. Yes.
They don't want to know that, but it
Right.
is true. But
They
we
do.
create testosterone also.
Yes,
Like
we
we are
do. Yes, we
basically
do.
of the same zygote, motherfuckers. Like that's what's so preposterous. So we were removed, like we were robbed of choice.
Yes.
Um, and it's so interesting to me looking at the landscape now, right? Like we're in this absolutely brutal moment for women's rights. It's pretty rough, and it's funny how they're trying to like in like bold daylight rob us, and they are robbing us of more choice and of
Right.
more rights. And maybe it's a stoner moment, not to out myself, but for me, I was like, once I kind of got radicalized and realized, oh my God, a bunch of assholes like made this, so it wasn't some random thing. It's not like, the science has gotten better. It's like literally, women got fucked. I don't know how else to
Mm-hmm.
say it. So
Mm-hmm.
like, I mean, if I just do the math with me, right, Nikki? Like 23 plus years
Mm-hmm.
of 40% of women getting ripped off their hormones. I mean, I believe other kind of parts of pharma really started flourishing in the 2000s. Is that right?
You think? Yeah.
I mean, I think
Antidepressants, right? I mean, yes.
our bodies use estradiol to combat cholesterol. Is that correct? How does it work?
So our bodies use estrogen. Or I'm sorry, our bodies use cholesterol to make estrogen. Cholesterol contributes to making estrogen. And so when we don't have estrogen anymore, our body starts pumping out cholesterol to try to
Mm.
get more estrogen. And that just doesn't work because our ovaries aren't working. But so a lot of women who are going through menopause will all of a sudden just have this really high cholesterol. And so then they get put on statins, and
Wow.
could have
Just
just
rockets
given
up.
them some estradiol. Yeah.
I mean, and not to mention, like the supplements world is so gigantic. I mean, I was taking black cohosh before I figured it out. I was on ashwagandha. I would listen to anybody with anything, buy anything. I mean, I know I spent thousands of dollars on nothing because
Right.
eventually nothing worked because it got just naturally bad enough where I felt like crap all
Right.
of the time. And I think you can try to tell yourself that those natural things are going to do something. And granted, look, it's not like HRT does everything. If you're still drinking every day, if you're obese, if there's a lot of contraindications that are just
Mm-hmm.
going to fuck
Mm-hmm.
with you and may obscure the goodness that HRT can even do. So I'm not saying that it can fix everything automatically, but like it can certainly,
It's a foundational piece to your health. That's the way I
yeah.
like to think about it. It is like, it's the foundation, right?
Mm-hmm.
And if that foundation isn't there, the things that you put on top of it just aren't going to have as good of an impact, right? Like
Mm-hmm.
because I would meet women, or women come into my practice and they're like, I eat really healthy, I'm eating
Mm.
super clean, I'm exercising every day, like
Yeah.
but they're just feeling horrible, it's like they're doing all the right things and they feel horrible.
I felt like that too. My hip hurt so much I couldn't. I'm in a band, Party Witch, and I remember like during, I think it was, I was like 52. this is during the pandemic, mind you. So, you know, you sort of think everything hurts anyway, because you're just sitting around, you're not going, you're not doing as much with your life. It was so depressing. But I remember like multiple things, like one, not being able to really like stand for long when I was practicing or playing. And I was like, what the fuck? Like, am I never going to be able to stand for longer than 15 minutes? And then going to rock shows, I was like, I mean, I couldn't get shoes that were comfortable enough. I mean, I've got them all. I've got Allbirds. I wanted those big, fat, clunky sneakers. Like it was terrible. And I was like, wait a minute. I went to the emergency to try to figure out, do I have hip dysplasia, hip cancer? I got, you know, x-rays, all kinds of things, went to physical therapy. Nothing helped. It felt like my hip was just grinding in the socket. And later, you know, after I did start HRT, and within 3 or 4 months, maybe 6 months, ultimately, like the pain was just completely gone. Like it would wake me up in the middle of the night 5 times a night because it hurt so much. I'd have to take drugs like Aleve or whatever every night. It was just so disruptive, but then it just went poof and it was gone. And I was like, oh, wow, that's interesting. That's a quality of life thing. And I think that a lot of my Menopunk participants have had similar problems, you know, especially with
hips and shoulders.
Why?
Right?
What is it? What do we lose in the hips and shoulders that make us feel so shitty?
It's because they're the big joints, and the hormones are actually very anti-inflammatory in our system. And so when those levels go down, our inflammation really, you know, cranks up. And for, you know, that's where we tend to feel it. The shoulders and the hips, you know, that's the most common complaint. But yeah, it's inflammation.
I think inflammation. I think there's a collagen thing too, because I believe like if you're back on,
it dries out your collagen.
Yeah. So I think if you once you sort of start hormone replacement therapy, your collagen comes back, like your skin.
Yes.
I mean, I have to say, Rachel Blumberg, this is a shout out to you, one of the most amazing musicians of all time. She's an incredible drummer, played with Bright Eyes, the Decemberists, and now plays with multiple bands and her own called Arch Cape. And she recently, because she's in my life and I'm like, oh my God, this is crazy, the hormones. She's like, oh, can I take that? She's feeling pretty down, and she looks amazing. Like it's like the light has come back to her face, the color is back in her cheeks. And I know that happened to me too, because I look at my driver's license. I should probably show people because it's entertaining, and I had this thing, I've run into women since that look just like me. It was so different, but I was just so round, and so bloated in this way that I couldn't really even see. And I was pursuing sugar like a motherfucker. I was drinking rosé every day, which honestly did make me feel better, but was like, but I couldn't stop. Like I wasn't necessarily an alcoholic per se. Like I wasn't putting myself into peril. I wasn't even drinking that much, but I was drinking every single day. And I was looking for donuts, and I just needed, I was like, and I was having headaches and I was crashing. Like it all makes so much sense now that I look back, but I was just trying to, I guess, fill the void that the hormones had left me in. Right. And I was just like, you know, a South Park character. It had really gone over the edge. I Cartmaned out, and I've run into a couple of friends since then. And I'm like, this is just so crazy. It's a thing. Like that kind of inflammation is real. Like, and if you don't really know, and you know, here's the really interesting thing. Almost all of those women were actually on an IUD. So they're like, well, my doctor says that, they're like fucking 51, 52, like right in the crosshairs of menopause. They're like, well, I'm on a Mirena, I'm on an IUD, and my doctor says just to wait, you know, until blah, blah, blah. And then eventually, like, maybe I'll do that. But like, just stay on it, because I used to bleed a lot. Like that, I've heard this from many, many friends. And so they're being told not to take hormones or not to supplement at all, because they're on the Mirena or on an IUD or taking birth control in their 50s. They're not fucking bleeding anymore, I guarantee it. Or if they are, it's not because they have their period. And they're like they're clearly like either close to menopause or menopausal, and they do not look good. I mean, they're beautiful women, incredible women. It's not about their weight. It's that I can just see, because I had this kind of moon face thing myself going on. And then I had Bell's palsy, which is a whole nother thing that makes your face crazy. That was insane, but that's another conversation. But like, because I looked in the mirror so many times, I really see it in other people. Can you talk about that from like a more like sort of hormonal medical perspective? Like, what is that, more of the inflammation stuff?
That's inflammation. Yeah, that's inflammation. Yeah. Yeah, inflammation. And then we retain water because that's kind of our body's response to inflammation, one of the body's responses to inflammation. And so, yeah, we just get puffy. Right. And and then I was just going to say, like, the estradiol. So estrogen is our hydrating hormone. That's the word I was looking for, hydrating. So it keeps everything, really hydrated and nice and plump and moist.
Glowing.
Yes. And so it affects our skin, our hair, and then the collagen, like you said. Yeah.
What about sugar? How does sugar sort of interact with like the hormonal, perimenopausal, menopausal body and system? Because I really struggled. That was so hard for me. Like, I still do sugar it out, but I've quit drinking at home, which means I've, for the most part, quit drinking ish. Like I have a couple drinks a month, but I booked nightclubs. I'm in a band. I've been in bands my whole life since my 20s, like, getting free alcohol constantly.
Right. All of a sudden your body just wasn't processing it the same, right?
Right. And I thought to myself, I remember thinking to myself, like, God, like, I'm not hungover. I don't necessarily feel worse, but I definitely don't look better. And I'm still drinking every day, but it can't be the alcohol. It can't be the sugar. But in my mind somewhere, I was like, but I feel different. Like something is not processing the same way. And I really still hadn't figured it out. But how does sugar interact with that?
Well, one of the things that happens is when our estrogen goes down, we get more insulin resistance. And the insulin resistance has to do with how our body processes sugar, glucose, when it gets into our bloodstream. And so it's basically your cells aren't able to take in that sugar anymore, right? So insulin is like the little transporter that takes the sugar in the blood and takes it into the cell for energy. Well, we develop this insulin resistance. So then it can't get through with the energy into the cell. So then you have two bad things happening. You have that cell that's not getting what it needs for its energy. But then over here, you have all of this extra glucose going all through your system in the blood. And it's horrible for your organs and for your vessels. Yeah.
This explains so much.
Right.
I felt so terrible. But let's get back. I really want to talk about the Mirena birth control conversation with HRT because I don't really know what to tell my friends. I'm like,
here's the thing. With the Mirena. And, and it really depends on what's going on with the person. Like maybe they've been someone who's had really heavy bleeding, that was so disruptive that they had to get the IUD put in, or maybe they've had endometriosis, right? So they have that IUD in to relieve the pain. So, or just for contraception, right? And we know that menopause hormone therapy, or HRT, we use those terms interchangeably, that is not birth control, right? So that's not going to give you any contraception. But on the flip side, the Mirena IUD is not going to give you any systemic hormone effects. The IUD is local. It's just in the uterus, right? It's just going to be right there with the uterus, the ovaries, and it's not really going to, go out much from there. So you can have both at the same time. That's not a problem. Or, it might be a good time for some women, depending on their situation, to trial having the Mirena come out and then to get the HRT on board. Because it's also hard to know, have you had your last period? You don't know if you have the IUD, because most people stop having periods when they have the IUD. But you can have both. You don't have to necessarily take out the Mirena just because you're starting HRT, but you can.
So you can have hormones and the Mirena. It's not one or the other. I guess that was something they seemed to think. I was like,
they do two totally different things. And also, so the type of progesterone that's in the Mirena is that medroxyprogesterone.
Oh, that motherfucking shit. God damn it. I hate that stuff.
It is not.
I hate it.
Yeah, it is.
I was on it and it was not good.
Yeah. So it's it's just different, right? And so they're doing two different things.
So what's bad about, talk about what's in the Mirena. So medroxyprogestin acetate is what's actually in the Mirena. I
just want to make sure
this is a live lookup, people.
I know it's not the medroxy. I said that wrong and I knew it right when I said it.
We'll take it out. Oops.
It's levonorgestrel, which is another type of progesterone.
Synthetic.
So it's a synthetic progesterone, right? And it's really good for protecting the endometrial lining in your uterus. So that's the part of the uterus, right, that gets all nice and ready for the egg to implant into it. So it's good to protect that. It's good to protect the lining. It's good for cycle control for people who have like really painful or really heavy cycles, but it doesn't really do much outside of our uterus. It's just kind of taking care of that part.
That local area. So, okay. So if a woman, not to say this, not as doctor to your patient, but like in general, if like women in their like early to very much mid 50s are on the Mirena and have with zero HRT, and they're clearly like at the age where shit is going down, and they kind of think that's all they can do. Like, what would you say? Like, what do they advocate for with their doctor?
Right. So, well, that gets tricky because it depends on how much their doctor knows, right?
Right.
I would just say to bring up the conversation about menopause symptoms that you might be having, because the truth is, in the conventional medicine space, with the amount of education people have right now regarding menopause, symptoms are really what will get you somewhere as far as getting some hormone therapy on board, right? So, I mean, if everyone could see a menopause specialist, that would be great, but that's just not available to everyone.
Yeah.
So, to talk to them about about your symptoms. Now, they may just say no, it's tricky because they might just say, no, you really don't need anything else. You have the Mirena.
But I mean, is that even true? If you're in your mid 50s, we need anything else for what? Like not getting pregnant when you're probably not even having a period? Like what the fuck? So, I mean, for me, the hack, and obviously if people don't know, I'm a total life hacker, which is like, it's sort of my secret, which is probably not much of a secret, but my life hack is when I realized that it was really happening and it was untenable. Like I could not have any kind of quality of life unless I got real hormones. I basically told my doctor that my quality of life was suffering. And I did, in fact, list off multiple symptoms that are like known if you go to WebMD kind of situation, obvious, like hot flash, I'm sleeping poorly, blah, blah, blah. And they basically had to give me something. And I said, I wanted to try estradiol and progesterone. And I actually called telehealth at Kaiser, not even my doctor, because my doctor told me, just wait. And I was like, mother. And so I didn't want to wait. And so I called telehealth, and I heard from other people through Menopunks related, like Instagram and stuff. I did the same thing that totally worked for me. So like the telehealth people are sort of trained to be like, okay, they say quality of life, they give you symptoms, here's the thing you do. So I will say to people who are, if it's okay, which I didn't know, to be on the Mirena or birth control and take supplemental HRT or MHT, then, quality of life is something really important to say, and then knowing what you're asking for. And I think, what would we want to start with? If I was on a Mirena, would I want to start on like what kind of like a lower dose of estradiol and micronized progesterone? Do you know?
Yeah, and it would depend on your symptoms, but for the most part, estradiol and estradiol and progesterone. Yeah.
Let's talk about my other favorite conversation, the patch versus the pill.
Yes.
I feel like we're in a good place for that. And then I want to talk more about rock and roll, because I feel like we have a lot in common in that zone, and it's such an important thing. But before we talk about sort of quality of life and quality of creative life and how like this part of our lives can really like fuck us or like fan us with this. I'm trying to think of something pithy and cute, but this time of life can definitely challenge us in ways that make creativity hard to access. But if you get yourself sort of handled and optimized, like it's a whole new like reinvention. Apparently, it's wild. But so I am on systemic oral estradiol and micronized progesterone because I am definitely more of a pill popper than I am a patch slapper. And I love the concept of sort of, transdermal stuff, but like, I do not like whenever I put Band-Aids on or whatever, like getting all that crap off of my skin drives me bananas. And I don't want to be doing that for the rest of my life because honestly, people, if you don't know this, but generally you can stay on bioidentical hormonal therapy for the rest of your life. And so do I really want to like be wiping off adhesive for the rest of my fucking life? No, but yet what I am seeing with my friends is that most women, if they don't know what they want, they're put on the patch. And they're put on sort of the lowest dose patch, and that's what they're on, and they kind of go from there. But I never, ever had the patch. Just, you know, kind of my weird journey. I was like, no fucking patch.
Either. I straight
Ooh,
to oral. I know.
Give me that systemic high five. Boop. I went right for the oral because I was like, you know, I like pills. I can handle it every morning. It's way better for my ADHD. Like boop, and I'm done. And that's like, I can really handle that. But the patch, like sloppy, like I want to know that I'm getting what I'm getting every day. So what is your theory on like the patch versus, you know, the pill?
Right. So I think, yes. So I think the reason that everyone goes for the patch first is because people are very risk averse, right? So people do not want to take, they want to use the least risky thing, right? And so
is this the doctor or the person you're talking about?
This is the doctor. This is the doctor, because they're, you know, they're afraid of litigation, and we've all been brainwashed into thinking that, you know, we're going to kill somebody with hormones. So we're just scared, right? And so here's the thing about patch versus pill. There are some people who need to use the patch. Those are people who have maybe a genetic condition that would cause them to have blood clots. That's the main one, right? So what we know with the oral medication versus the patch is, though, even though when you really look at the science, there is not that much of a difference, but the patch does have less of a risk for blood clots. But that isn't even going to affect most people.
Yeah.
Most people don't have a genetic condition that's going to cause them to have blood clots. And this doesn't count like if you were like on an airplane and you got a DVT, like a blood clot in your leg because you were sitting so long. Like there are things, or you got a blood clot post-surgery, right? Because those are things that just happen, and they happen to anyone.
Right.
So
it's genetic.
But yeah, if you actually have a disease, like a condition that causes you to have blood clots, right? It's not something that was external that caused it. Then you are better with the patch. But for most people, oral is safe. So I always have that discussion with my patients. Honestly, most of my patients choose the patch, which kind of surprises me, just because I'm like you. I don't want any sticky thing anywhere on my body. But for them, I think they just like it. They just put it on there and they forget it. So, you know, as long as you aren't, as long as it isn't contraindicated for you to have the pill, then it's just a personal decision, right?
Well, and here's the thing that I'm getting feedback from my friends, my menopunks on, which is that, well, first of all, I think the patch is way overprescribed, and it's also way more expensive than the pill.
It is so expensive, and they end up not really dosing it high enough a lot of the time. From what I've seen, I have people come in to me on these really low dose patches, and their symptoms aren't even being controlled. And that's like the first goal when we start the HRT, is to get all those symptoms under control. So, and I think it's just like the same thing. Providers are scared.
And it's too bad, because like, you know, I went on 0.05 of estradiol at the beginning, and that was like a good start. It certainly helped, but in a little while, like in a few months, 6 months, I was like, oh, I feel that lethargy coming back. I feel the hot flashes coming back. I personally just took like self-titrated, and I took a little bit more, went to 0.075, and I was like, I do feel better. And then I remember going to my friend's house, and I was like, oh, she's like half the size. And I'm like, dude, you're on a milligram? Okay, so I shouldn't be afraid to go on a milligram. So I basically like, you know, waited until I felt any more symptoms coming in, and I went up to a milligram, and I was like, oh, this is my zone. Like now I really feel a lot better. But the pill is generic. The pill you can get in a 90-day supply.
Ever.
The pill, this pill, not the pill, but like estradiol in an oral like pill form is so much cheaper. And like my same friend, Rachel, I hope you don't mind that I'm talking about you. She won't. I love her. I'll get her permission before this comes out, and then I'll have her on the next podcast. But she, you know, was on the patch feeling a ton better, but then they ran out of her kind of patch that was covered by the insurance. She had to get some other kind of patch that wasn't covered by the insurance. And it went from like $50 to $200. And what do you do? At that point, you're screwed. If you're like, this is the thing, people, if you get off it, it goes through your body so quickly that you are screwed. If you can't get it, or if it's too expensive for you, or if something, like, you're going to feel like shit. And then it gets harder to kind of get back on it. Going on and off it isn't good for your body either. So like, that is so dumb with the patch. So like, I have friends that are on the 0.0175, which is an insanely low amount. It's crazy low. Then there's 0.0375, still crazy low. So like, I think that the super low dose patch is highly overprescribed, and people are afraid of the pill because of lies, not because of reality. Mm-hmm. And so right. I just want to like put it out there with you listening to what I'm saying and verifying as someone who's actually in the medical field, that unless you have a genetic condition, you can ask for systemic. And, you know, what I've heard from in terms of dosage is that, and whether or not this is right for you, I don't know, but like, it really isn't until 0.05 that you even get any preventative benefits from estradiol. So, is that correct?
You know, and everybody, you know, approaches this, you know, providers will approach this a little bit differently. And like we said, a lot of it has to do with fear, but honestly, all of my people start at like 1 or 2 milligrams, or we start at 1 milligram and then we go up to 2. And because just that's what it takes to get their symptoms under control. Right. So what I would say to people who are, you know, out there trying to navigate this, if your symptoms aren't under control, and I always say, let's give it 4 to 6 weeks, right? Like, let's give our body some time. If you're in the, you know, you've been taking it for a month and a half, and like, you really should not be having any hot flashes. Like, they should pretty much be gone. Then I would be getting in touch with and asking for a higher dose.
It's so funny. People are just like, everybody's so hesitant because of the lies. Like, really, like they think, oh, I'm going to get a blood clot. Oh, like, it's just like, no, like if you have a genetic condition, it's not as widespread as what people think. And I mean, those patches are like, there's a huge shortage in Australia. Like in the UK, they go through shortages. It's so dumb. Right. So like, I'm not saying people are dumb. I think people are brilliant. They're wonderful. But I do think that, like, you know, something as simple as a generic hormone pill, yes, like estradiol.
It's a tablet, you know, it's like, it's not even a capsule, it's a tablet, you know.
I mean, it's so cheap and like, you can go through all these like GoodRx and all these things online and get it even cheaper. Like, I think, you know, people should have more confidence in asking for that, because the patch is fine. And I do think it's great for people who have those risks, phenomenal. Or if you, for some reason, need transdermal, or if that's your preferred method, whatever. But like, first of all, hearing that most of your patients start at 1 or 2 milligrams is really, that's new information for me, because it took me 2 years to finally titrate up to 1 milligram. And even now I'm still getting a little bit of breakthrough here and there. And I'm like, okay, I thought that was maybe too much, but what is too much estradiol?
You know, it's not about too much. It's about what's right for each person.
So how much do trans folk get, for example?
Oh my gosh. I mean, I would start my trans patients at 2 milligrams a day. That's where we would start. And then we would just go up from there until we got the results that we wanted. And we've been giving trans folks a lot of hormones for a long time. You know, they're not getting blood clots. They're not having heart attacks. They're not, you know, bad things are not happening.
Well, they are, but not in their body.
Well, yes,
bad things are happening in the world. Everybody's being an asshole to trans folk. We love you. Yeah. We stand so shoulder to shoulder with the trans community.
Yes,
and honestly, the interesting thing coming off of that, because I think we made our point with the pills versus the patch, but like, I mean, do you think that the assholes are coming for our hormone therapy?
They're already trans folk? Well, there's that. I mean, they're coming at women in general, right? And I mean, and trans folks, obviously. They're already coming for our birth control.
I mean,
yeah. I mean, it's just, right? What they're going to say is that it's just not necessary. But can you imagine if every man hit 50 and his balls fell off? Like, they would find we would have had a solution for that 50 years ago.
It's so true.
They would not.
I know.
Or I heard, I was just watching an interview with Dr. Avram Blooming. See, I don't remember these little, you know, the little things.
He's a rock star in the field.
He is. So I was watching, and I'm actually taking a class right now where I'm going to get to ask him some questions in a couple weeks, and I'm so excited.
Paul McCartney situation.
I know. So anyway, he was saying, like, can you imagine if a man hit 50 and then all of a sudden his doctor said, now listen, probably 3 or 4 times a day, your temperature is going to go up. You're going to get really hot. You're going to get sweaty. You're going to get red, and it's going to last for like 5 minutes. And you're not going to be able to control when it happens. You could be in an important meeting. You could be on a, whatever. Do you think, like, are men just going to tolerate that shit? No, they would have figured it out.
And not to mention, that's just one symptom. And you can't think, and you forget what a potato is. And you you have no energy, like there's so many millions of things. If they said that to men, that your balls are going to fall off, that you won't be able to access simple thoughts. You'll have no energy for anything.
Or enjoy it.
Oh my God. You think that they would be like, oops, sorry, boys. No, they'd be like, give me that pill. And this is the only thing I think that might maybe stand in the way of HRT being taken away from cis women, at least. And not to say that it's all bullshit, but there is such a huge industry with testosterone, right? Like so many, like we talked about before, so many Revive health clinics or whatever. Like
it is so easy for men to get testosterone. You can get testosterone from your PCP if you're a man. I mean, they just do a lab test. If you're low, they just give it to you. I mean, so that's a hormone. Just normal. Yeah.
And that's hormone replacement therapy. Am I wrong? That is what it is, literally.
Gender affirming care. It is gender affirming care.
Speak it. Gender affirming motherfucking care. Did you guys hear that? Gender affirming care isn't just for the beautiful, most vulnerable sweethearts of our population, trans folk who are just trying to become their true selves. I mean, imagine the misery of living in a body that doesn't feel like your own. They just want to feel they're living in a body that doesn't feel like who they are. I get that. Sometimes I've felt that way. I mean, I've grown into mine, but I think everybody has a different experience. And, if there are 1 million Revive health clinics and there's 8,000 kinds of testosterone, are there any kinds of testosterone for women even?
Nope. Not even one. Not one FDA approved version. I think the UK finally just got their first approved
snaps to the UK. It's probably sold out. I'm sure they don't have it for much. But so if
in the United States, we do not have any testosterone that is approved for women. And women have testosterone, right? It's one of our main sex hormones, and it goes down just like the estrogen and progesterone do when we're in menopause, and it needs to be replaced. For most women, they're going to be having symptoms, low libido, low energy, low motivation, brain fog.
Do you think muscle wasting. Muscle wasting? So do you think that men's unfettered open access to HRT would maybe potentially stop the attack on HRT for women?
Because they're going to say, how could they justify? FDA approved, because it's FDA approved for men, and it's not FDA approved for women.
But not testosterone, but at least estradiol and microprogesterone are. I'm saying general versus testosterone. Yeah. Like, could that stop that attack?
I don't know. Honestly, I'm pretty pessimistic when it comes to the patriarchy, in case you haven't noticed.
Can it help us for once? Like, maybe the fucking assholes.
Sorry that I cannot give you a bright moment of hope right now.
I was just trying for some hope. I mean, it's dude, like, like all I want out from this film, from this moment, from Gen X, is just to like shake everybody collectively and let them know that there is hope, because the things we thought were the truth about hormones were actual nefarious, evil fucking, sounds like a conspiracy, lies. And the truth is that these things are like what's in our body already. They took that and they turned it against us. So like the things that were going to save us became literally turned into something that was going to kill us. Like who does that besides in a Batman movie? Like,
I mean, and isn't this the whole point of one of the whole points of the Menopunks movement, is to get the word out, right? Mm-hmm. We need to just start, with the women, right? We need to just let the patients know, right? Like, people have to advocate, because the more people who are asking for it, the more people who are educating themselves, and then they can go in and they can ask for exactly what they want. And then their provider, if they have a good provider, is going to have to go and look that up and get the latest information.
And I think it's like on some level luckily there's people like you and Aoife and other menopause specialists. There's so many now in their 50s and 40s where they're feeling it. And, as like, laser focused as some doctors, medical practitioners can be, until it happens to them, they might not worry about it. Right. But yet I feel like now we're finally getting into this. Maybe there's a critical mass occurring. I mean, it hasn't happened because clearly like nothing has really happened within the medical establishment to change this education. It's starting to. I feel like we're being such bitches about it and we're being so demanding, and we are so often educating our providers. There are some
programs that I have heard about now, some medical programs who are revising their menopause education. So it is starting. Things are moving. Things are starting to move in a different direction. Yeah.
Yet not fast enough, because I have multiple friends who've had both kneecaps replaced or both knees replaced. I have another friend who's going into surgery to get her hip replaced. She's 60. Are you on HRT? No. Why? Because, well, my mom had cancer and I don't, but I'm just, I worry about it. So if somebody came to you with something like that, full on hip dysplasia, like recommending that you get her fucking hip out at 60, this is a filmmaker I know. It's just, I couldn't believe it. They're not on hormone therapy, and they're not personally dealing with the contraindication, but they had a history. I mean, my mom has had breast cancer too. They've had a history of breast cancer or cancer. What would you say to them?
The thing. A family history of breast cancer is not a hard stop for menopause hormone therapy. You still need to have, there's a discussion that can be had. You just go over the risks, you go over the benefits. You need to make sure that you understand, all the potentials, and you get to make that decision. The only person that gets to make the decision is the woman. That's the way it should be. It's like, we as the providers are here to give you the information. This is what we know. This is what the studies show. This is what the science tells us. This is how it's safe, and this is how it may be unsafe, and this is what we don't know yet. And let's look at your specific situation, and you get to make the decision.
So educated choice, what a concept,
yes,
right?
Yes.
Like factual, based in science choice, which would have been nice to have for the past 23 fucking years. Like,
we call it informed decision making.
We deserve that. I mean, do we deserve anything less? I feel like it's just like, I look at this orange hellscape that we're dealing with these absolute fucking like snail turd motherfuckers.
Cheeto taco tits.
The tittiest taco motherfuckers.
Yes.
And those fucking dicks like are just having so much fun with the keys to the Porsche right now and just driving it into the ground and not changing the tires, like everything. And by the way, feminism is the Porsche basically, or like the country is the Porsche, like all of it. And this is literally where the idea for Menopunks, or why I will make this movie, no matter if it comes from my fucking credit card or not. Hopefully it will not forever. But like, we were denied this simple choice, right? By all of these lies. But if we can have access to this again, and if we can educate and inform people about what their options are, maybe we can make a dent on turning the tide from this narrative of HRT causing breast cancer, and at the same time get back to that 25% of women that are on hormone, or 40% or 50. Let's go for fucking 80. Because can you imagine 80% of women in their like menopausal, perimenopausal age, or just like women for the ages like 35 and fucking 60 or something, and they feel like we feel, which is
they're alive, they're energized, they're excited. They feel like they have a purpose.
Yes.
They're out doing their work in the world, spreading their wisdom,
yes.
Supporting the younger women.
What would happen? I mean, this is the thing. Like, I mean, these assholes, like, I mean, you look at like Stacey Abrams and all like how like Kamala and like women who like, especially Stacey is such a great example because she's like so on the ground, Atlanta and Georgia, and trying to make all this change. And we need like 1,000 million Stacey Abrams, right? But like, I think about all the women I know that are in the Stacey Abrams zone. They're fucking tired. They're not hormonally optimized. They're dealing with these like, symptoms they don't even know are symptoms.
They can't even think.
Well, they have this like, I have friends with all these like, weird like fibromyalgia or like all these inflammation diseases, and they don't even ever go away unless you're hormonally optimized. So, but they don't even know what the symptoms are. So they just feel like shit. They give up their jobs, their businesses fall apart, their marriages, their relationships fail, everything. I mean, it literally just is the life destroyer. You know,
and
this
here we are,
thing.
you know, like optimized, right? You and I, and here you are, you're making a film.
Yeah.
Right. You're making
not only making a film,
yeah.
I'm doing
a series.
I'm making a series. I'm teaching school. I have a band. We just made a new EP. I just got married. Like, I'm at a fucking beautiful, absolute apex of something I didn't think I would ever have, right? So the math, bear with me here, and you are too, right? So these assholes, if we can multiply Stacey Abrams by millions, right? And I don't know if Stacey Abrams is optimized, and shout out, Stacey, I sure as hell hope you are. And if you aren't, please God, I wish for you full optimization as soon as possible.
Can you imagine if she's not?
If she's not, and this is what we're getting, if Stacey Abrams gets optimized, fucking, she's got my vote, let me tell you right now. But like, imagine if we have millions and millions, we're at 40%, we're at 50%, and like, this is a revolution, truly, of women reclaiming this choice for quality of life.
Yes.
I mean, it will change, because look, what the fuck's going to get out of this? Like, what's going to get us out of this nightmare besides Gen X? Like, we clearly cannot trust the motherfucking boomers who are like half infiltrated by Fox, no matter what you tell them. And then the lost generation is like, it's too late for me, and I just got my retirement, so fuck it. And they I'm not saying all of them. There's some amazing people. And shout out to like Liz Winstead from Abortion Front, and so many other incredible lost gens who are doing great work, but like, they want to feel good too. And it's not too late for most of them to feel good. So like, you know, we as a generation, I think, are in a position to make the most change, not just for ourselves, because we're the ones with symptoms right now, right? Like, it's fucking hitting us full in the face, but we have the possibility to make change for those older than us and also younger than us. And I love, like, I've seen some teenagers, including my teenager, wear a Menopunk shirt. And I'm like, can you show people your shirt? Can we see your swag? Yes. You wore your beautiful shirt. There it is. Oh yeah. Hey, there it is, representing. So like, I love that, I love that my teenage boy knows what menopause is, right? And he knows what I'm in the fight for. And it's so interesting. Like, we need to sort of lift the veil on all of these lies so that future generations have a motherfucking future.
Right. And, you know, it's not like, you know, that we're trying to make everybody take hormone therapy, right? No, it's just like, but everyone deserves to have the conversation and to have the choice and to know the truth about what it means and how safe it is.
Here. All right, that's what we want. We're gonna finish this off because we're already at an hour 12. We're gonna.
Is that possible?
It just went like that. I know, because it's fun to talk to you. I love it. But let's talk about rock and roll a bit. So we, Menopunks we're doing our very first Menopunkapalooza, which is a real thing.
Got my ticket.
Oh yes, queen. And so look, there's a thing that is like sort of a wild imaginative thing that's going on. There was perimenopausapalooza, or no, perimenopausapalooza. And honestly, like, I had the idea for Menopalooza before that, and then she came up with that, and I was like, well, this is not real, first of all. But second of all, we have to now be Menopunkapalooza, not just Menopalooza.
Yes, that's right. Menopunkapalooza. Yes.
Because I feel like it's more specific. And also I feel like Menopunks doesn't just refer to perimenopause or menopause. It refers to the whole thing. Meno is in all of it, right? So we, out of the blue, Team Dresch, featuring Jody Bliley, one of our core participants. Jody and I are friends, and I have to thank Menopunks for that, because I wasn't that close with Jody before the film, but I was like, oh my God, you're so cool. I want to talk to you. Will you be in my movie? And she's like, fuck yeah, Alicia Rose, I'll be in your movie. I mean, that's a terrible Jody Bliley impression, but she's just such a cool person. We know each other from different parts of the music business. I used to be a music distributor, and I booked a billion nightclubs. That's where I come from. I booked Doug Fir, Mississippi Studios. I booked in the early 90s. I met Jody Bliley in 1993 when Hazel played The Chameleon, a show that I booked in San Francisco. So that's how I first met Jody. So we've known each other forever. We've become friends. And so I basically was like, It's like, when is Team Dresch playing? They just played the South Sound Block Party. I mean, there's all these pictures of them looking like fucking boss ass motherfuckers. And she's like, oh, we're not going to play Portland. I'm like, you're not going to play Portland. What are you talking about? She's like, well, I don't know. I just don't really want to play here. And I was like, well, would you play if it was a benefit for Menopunks? And she's like, oh yeah, I do that. And I was like, you would? I was like, well, let's do it. December or when? She's like, well, let me take it to the band and see what they say. And I'm like, okay, great. I mean, amazing. Maybe this will happen, Menopunkapalooza. And so, I think less than 24 hours later, she got back in touch and she's like, all right, how's September 18th? This is like last week, and today it is September 7th. This will probably air later, maybe even after the show. But I was like, okay, that is in 3 weeks. What? And so it's happening. So basically, Jody, who didn't apparently want to do a Portland show, was delightfully convinced by my, it is going to be a benefit for Menopunks because we got into the Bend Film Base Camp, which costs money. So they're going to help us fundraise for that, which is amazing. So now we're doing a show at Bunk Bar on September 18th, and my band Party, which is going to open. But I like the idea of Menopunkapalooza. And yes. I mean, are you an avid showgoer? Do you play music? Where are you at in that zone?
So, not as much as I used to be, right? Just because age, family, all the things, right? Back in the day, yes, I was at shows several times a week, but I wasn't in the Portland scene. I lived in Seattle, right? So for those formative years. But I did see Hazel in 1996 at La Luna.
Ooh, hello.
At that time, I was, a couple years out of high school, and I grew up on the Oregon coast, and my friends and I would drive out to Portland to see punk rock shows, and so we came out to see Hazel, and that was like a huge highlight.
I love it.
Then I went to the University of Idaho for undergrad, and I had a college radio station where I played a lot of Riot Girl.
So you had a show on the college radio station?
Yes,
I
did.
Shit, girl. Oh.
Yeah, with my friend Robbie Rocket. And we
Robbie Rocket, such a good radio name.
Who was the guitar player for the Mines, if you knew the Mines here, right? So Robbie and I had a radio show together, and I played Bratmobile, which I was so happy to be able to tell Allison that when I saw her on the last episode. And then I moved to Seattle, and after that, and I was part of a band which was it was all girls except our drummer was our dude friend, and we were a punk rock band called the Bad Dates. And
I like it.
We were horrible, and we had so much fun.
What do you play?
I played the Bad Dates songs on a guitar. I only ever played the Bad Dates songs. I don't know how to play a guitar. They taught me their songs, and I played.
I mean,
and we got to play good shows. I mean, we played at the Crocodile, we got to play some really fun shows. But it was.
But do you still have a guitar? I mean,
well, I do, but I just gave it to my son because he is starting band in 6th grade, and he wants to convince his band teacher to let him play guitar. So we got out the guitar and started teaching him some chords. My husband plays guitar. He really plays. He
actually plays guitar.
Yeah,
well, look, here's something I reposted on the Menopunks Instagram today is that I will never have imposter syndrome again after looking at these assholes in Office. I mean,
yes.
I used to struggle with imposter syndrome for a million years. I have made so many albums. I have toured all over the world as Miss Murgatroyd and other ways. Yet I've always felt like an imposter. I couldn't call myself a musician for a million years. I mean, and this is after multiple Miss Murgatroyd records. And I mean, but now at the age of 55, I give 0 fucks, and I own that musician part of myself. And it's only because I do it every week, once or twice a week with my best friends, that I've gotten better. So I would say to you, which is, I get that you're sort of maybe feeling a little impostery, which is why I mentioned that, and not to say that you are, but
yes. No, I totally feel that way.
Okay. So here's my prescription as not a doctor, but as a doctor of rock. I'm sorry.
Doctor of rock.
That's the first time I've ever said that, and everybody can be just incredibly mad at me because it was so dumb. But as a pretend doctor of rock, I would say, I prescribe you playing guitar once a week. and just like finding some friends to play with and playing with a friend and just jamming. Because for us in Party Witch, like that's how we write all of our songs. We don't, I mean, I wish I was like a really brilliant, precious songwriter. It's like, I'm going to write a song about Greta Thunberg and her incredible journey across the sea. But no, I did write a song like that. It came straight out of my brain in some weird ass practice. We captured it on an iPhone, then eventually went back and we're like, that was amazing. Can we make that into a real song? So like all of our songs come from like absolute like channeling from the universe into our bodies, chemistry off each other, just being bad together. And just using our, at least me, I'm definitely limited skill set wise. My voice has become pretty incredible. I will give myself that, but like,
I love your voice. I love
thank you.
I went and found Party Witch on Spotify after, you know, we had talked, and I've been listening to it. I love it. It's just magical. It's
thank you. Well, it took me learning how to play the drums and being terrible at it to even access the voice that I use now. Like I was super not confident. I made 2 records that were partially vocal with my friend Petra Hayden. I was so embarrassed because she's such a good singer. But, you know, I started learning how to play the drums when I turned 40. So that's a long time ago now, 15 years ago. And I'm like, oh, and by picking up an instrument I didn't know at all, my weird ADHD brain somehow, like I was like, I'm going to learn how to sing and drum at the same time. And it made it easier to find my true voice as a singer once I started playing the drums. And so now I'm a singer and I actually really love my voice. I can't really believe what my voice can do. I didn't know I could do any of that. So it's kind of mind blowing, but as again, coming back to my prescription, my doctor of rock prescription for you is, you know what, like put a dumb Instagram post out or put like a Facebook thing up, or text some friends, be like, who wants to jam once a month or whatever, take that guitar back for a night and go rock out with your friends, because
I'm gonna go play the first songs that I ever played, which were the Mummies.
Just do it. Oh my God, easy. The Mummies! Shut up! I have like 15 Mummies singles in my basement because I used to book shows with them all the time in the early 90s, and for some reason I wound up with like 15 of this rare single. I shouldn't say this, but that is how I've bought dinner a few times. Anyway, so I'll have to let you borrow that. Anyway, so but play the Mummies, play anything. Like I think play along to music. I think playing music, I mean, it got harder for me only physically and energetically when I was crashing from hormone deficiency. And I really wondered if I would ever be able to do it again. But then I found relief in optimization and I was like, oh shit, hold on. Like now I feel good. Like not just kind of good, but like really fucking good. So my creativity skyrocketed. And then we wanted to play, Shauna, my drummer, was dealing with the same stuff. She was miserable. She was trying all the black cohosh, all the herbs, everything. And she was just like a miserable wreck. And we were trying to play together and it was not going well because she was miserable and I was like, woohoo. And she's like, maybe I should get on the hormones too.
You're
like, I was like,
if you're going to be in this band, you have to have HRT.
Yeah. I mean, it wasn't a requirement, but I was like, can you just look into it? And she did. And she was like, Alicia, I can't believe it. Like, I feel so much better. And she's like, just totally zoning now. And it helped her with her arthritis. I mean, she still struggles, but like our bodies we can kind of end-ish now, but like leading toward our end, like our bodies don't like being drastically hormonally deficient. I mean, we like one thing that we didn't exactly mention is, you know, before this era, this modern era, this internet era, even before the internet era, people just didn't live that long. You know, like most animals that are female with reproductive systems, they die before they reach menopause. Well, we're in this new future that's like as much perilous as it is promising, right? Especially in this fucking moment. And I mean, a lot can really change for us. Like it's a whole new thing where I think that if we can find our way through with accessing these things that aren't necessarily hard to get, you know, we can find ourselves again. You know what I mean? Like all of my friends, I swear to God, every woman I talk to, every person with ovaries who's gone through menopause has really said, like, I don't feel like myself. I thought I was dying, or I feel like I'm dying. What is wrong with me? Like that. And they're just like, they can't sleep. Like their quality of life has gone down the pits. Like that's inevitably going to affect your life. It's going to affect your creative life, every part of your life. But look, it's not natural to go through menopause. Human beings are now living longer than they ever have before. Like, I mean, both my grandmothers died in their 90s. So that means I went into menopause at the age of actually 55. I was pretty late for some, which now I realize was kind of awesome. Thanks to my genetics. Thank you, genetics. But like, you know, I went into menopause at 55. That leaves 40 plus years. I mean, hopefully I'll live to like 150 and I'll look amazing, because that's what I'm hoping for, because that's going to be the future we're going to live in, because women are going to take over everything and fix the fucking world, Gen X.
Yes,
but
yes, we are.
We have at least 40 to 50 years, really half our lives to like be in this zone. And if we have no hormonal help at all, our bodies basically eat themselves, because these are the building blocks of our bodies. Like, hormones are where everything comes from. The GLPs, the weight loss stuff, like, you know, the best fixes in the world are the ones that started with being naturally produced in our bodies. So like, what is menopause? If we're going to have it and it's going to be half of our lives, is it really natural if this is new for all of us anyway?
Right. Right. That's a good point, because there will be a lot of people that will say, oh, it's natural. Don't poison yourself with hormones. I've heard the craziest stuff lately from, you know, well, just from people on the internet.
What's that?
Yes, the internet. But yeah, you're right. It's not natural for us to be living without hormones.
I mean, our bodies want them, dude. The natural state of our bodies is when we feel fucking great and we're pumping it out, we're bleeding, all this stuff. We have to deal with periods for how fucking long? Like, how much money have we spent on stupid menstrual products? You know what I mean? And like, finally, we're in a zone. We're not bleeding. We have to spend any more money. A week of my life isn't trashed because of cramps and headaches and whatever the fuck else. Like, I don't have to live my life around the misery that I'm going to experience for 5 to 10 days. I mean, that's exciting. So suddenly now in my 50s, and are you 50 yet as well?
I will be 50 in March.
Girl, we're going to celebrate. But suddenly now in our late 40s and 50s, we're like, well, so wait a second. The period stops finally. And now I just feel like shit. No. There's another answer. The period stops. And now you get to live your real, full, beautiful life. And ideally, you've at least asked questions to figure out if you can sort of, replenish what has left us like lemmings over a cliff, right? And if it's good if it works for you and you don't have any contraindications, get that motherfucking pill, get that, get that therapy, because like, we've been lied to and the truth is much rosier than the lies. And so it's really it's an interesting inflection point in time, because Gen X, we're just such a pain in the ass.
Well, we just don't. Every Gen X woman by age 50 has used up every single fuck that is left. And so now is the time to become optimized in our hormones, because this is when we are really going to do our best work in the world.
We're going to have to, I think we're going to take the world back. Is that what's going to happen?
That is what's going to happen.
Let's fucking bitch slap these motherfuckers and like do what needs to be done and take it over.
To bitch slap the patriarchy.
We're here to bitch slap the patriarchy. Like, I honestly think about it and I'm like, okay, I can accept this misery because we know now they're all pedophiles and shitbags. Like, it's all just out there hanging in the wind with their undies, right? Like, it's just the worst. So we know that they're bad. So there's no better time to overthrow the patriarchy and the government. Like, right? I think revolution now.
And of course it's Gen X, of course.
Of course.
Us in the background, totally forgotten, but just taking care of business.
Well, Riot Girl said it best, right? It was Revolution Girl style in the early 90s. And now let's call it Revolution Menopunk style.
That's right. Yes.
Right? Nikki, thank you so much for being here. You're
just
fucking awesome. This will not be the last time. You're going to be here all the time if I can have my way, since you're not already podcasting. So thank you so much for being a part of this. I think people are going to get so much out of what you said, and just hearing from somebody with experience, personal and professional. So thank you. And just, keep rocking on, mama.
You too. You're doing the best work in the world.
Yay! Menopunks for the win!
That's right, yes.
Are you a menopunk? For more information about the movie, the Menopunks movement, Menopunks merchandise, and more, go to www.menopunks.com.